Good morning. I'm Eugene Scott. I'm a political reporter for The Fix here at the Washington Post, and I'd like to introduce our speakers in this next segment. Jesse Milan is the president and CEO of AIDS United, a nonprofit committed to ending the AIDS epidemic. Mr. Milan is also a longtime advocate and nationally recognized expert on HIV/AIDS programs. Congresswoman Eleanor Holmes Norton has represented Washington, D.C. in the House of Representatives since 1991. She is also a member of the Congressional HIV and AIDS Caucus. Phill Wilson is the CEO and president of the Black AIDS Institute, a national HIV/AIDS think tank focused on Black people. Mr. Wilson has been a decades-long advocate for those living with HIV. I want to remind our audience in the room and to those watching online that you can tweet your questions to us using the hashtag #PostLive. I will relay them to our panelists. Now let's get started. So when you think about addressing this epidemic, HIV and AIDS, in this current political climate, what concerns you most? We will start with the Congresswoman.
What concerns me most is that we are in a period when we are receiving cuts of every kind. And those of us, not only in the HIV caucus, but among many members of Congress, are very concerned when cuts are made where we have achieved some progress. And I should tell you that I know of the current appropriation that there is on the House side, what we call level funding, no increase. And would you believe that is considered a win in this Congress? Because the president indeed put in a budget for almost 20% cut. And on the Senate side, we don't know yet. But that means that when the appropriation comes up, and you may know that we're probably going to get a 2-week extension. We're going to get a number of extensions because it still is controversial, that at least we ought to be able to get no cut, which is a cut. Because, of course, expenses go up, costs go up, and when you get no increases, you don't account for inflation. And whatever is the targeted and important issue gets hurt. And that's what's going to happen with HIV, where we'll achieve some progress and may lose that progress.
Indeed. Phill, can you speak about that in relation to Black people and the communities that you work with in your nonprofit?
Certainly. You know, there's a huge elephant in the room. Dr. Fauci and Ambassador Birx talked earlier about these new tools we have. And certainly we have some tremendous advances over the last few years. And we have new and better tools, better diagnostic tools, better surveillance tools, better treatment tools, better prevention tools. But here's the rub. None of it matters if people don't have access to health care.
Right.
Full stop. You know, ending the AIDS epidemic in our lifetime is over if people don't have access to health care. So the biggest threat that we have today is making sure that people have access to these tools. Earlier they talked about how it's difficult to reach Black, gay, and bisexual men. Well, quite frankly, I'm tired of that because we're not difficult to find. People are not interested in looking for us. So that's the deal. And so we need to make sure that the tools are there, but that they're available to people and people have access to them.
Jesse, when you think about access, are there parts of the country that you see disproportionately not receiving the amount of education and attention that this illness deserves in their communities?
Well, the southern United States is unfortunately having an HIV hurricane, literally. Literally, 40% of the people living with HIV are in the South, for more than half of new diagnoses, the new infections, all of those are primarily happening in the South. So we have to really focus on the community will, and I loved what Ambassador Birx said earlier. The political will needs to be at the community level as well as at the national level in order for us to expand access to care. 40% of people living with HIV access their health care through Medicaid, and those states in the South where Medicaid has not been expanded. So the pathway to getting to access to care is actually closed for a lot of people, particularly in the South.
How do you educate young people about how this epidemic, it's still very much an issue. When I talk to high school students and even millennials, they seem to think there's a cure. They think of people like Magic Johnson. They think of just other issues getting more attention, like the opioid epidemic. How do you help people realize that this is still very much a concern, Congresswoman?
We can't let progress stand in the way of prevention. So that means it falls to us, frankly, to make every generation know that progress will not be there for them unless they take it a step further. They don't need to get HIV. Mm-hmm. That's how it should be laid to them. You shouldn't look at people who've been cured. Look at people who've been cured of tuberculosis. You want to get tuberculosis? Right. If we can keep you from getting it, and there's a way to do it, then that's what you do. It's some of the words, when I remember when this epidemic first began, I don't even hear them anymore, like safe sex. What happened to safe sex? Why did that disappear from the lexicon? Why didn't we say to a new generation, at least that old-fashioned, that's what it is now, slogan. So look, you have to educate every new generation about not getting pregnant. I mean, it's really the same thing. Well, we may have we may not have had birth preventatives before we have them now. And so you tell people about birth preventatives. You don't just say, don't get pregnant. Well, here we're not even mentioning HIV/AIDS. And the role models that may have encouraged them to look closely at the disease, they don't see any longer because people know how to go get treatment themselves. I think we need some of those role models. We need to bring some of those role models out so people can see that, yes, even the rich and the famous can, and at one point could get this virus, and so can you.
Indeed. When you think about communities that aren't seeing this illness mentioned, one area of attention that people seem to have forgotten about is how global this illness is. Michael Gerson, a columnist here for the Washington Post, wrote last week about just how less attention Africa is getting in terms of treatment and education regarding this current administration. Are you seeing that, Phil, when you look globally at the issue?
Absolutely. Now, to the question of how we educate young people, we have to go back to trying to do that again. No, we're not doing that. You're not going to help young people understand the epidemic if you're making cuts to the CDC. You're not going to help young people understand the epidemic if you're not doing sex education and HIV education in the schools. And that's true here in the United States, whether we're talking about the Southeast or we're talking about the Midwest, or whether we're talking about the global epidemic in sub-Saharan Africa. Now, a lot of work. Now, we know how to do this. We've made progress. The challenge we're having now is that we're not doing what we know. We need to make the investments now to continue to do the work. It's like running a marathon, and you're at mile 20. You obviously know how to get to the end because you've run 20 miles, but you still have to run the remaining race. And right now, we're not running the remaining race.
Jesse, when you think about maybe one specific issue why we are not doing what we know to be effective, why is that?
Well, I think the community will has to be addressed for all of us. Each of us is part of a community, we're also part of a family, and the stigma of HIV still continues. And if we're not willing to literally talk to our own friends and family about HIV, then how can we actually address what Congresswoman Holmes has just talked about? How will that 13-year-old know that this is a problem and that they can do something about it?
Indeed. Congresswoman, you have been in Congress for quite some time, and you have seen how HIV has affected this community, Washington, D.C., in ways that many people around this country just have no idea. Can you talk about some of the changes and improvements you've seen and what continues to be an issue?
Well, if I may indict the body of which I am a part, the Congress of the United States, because that is where much of the problem lies. And I'm not just talking about funding now. To give you an idea, talk about the southern part of the United States, I have seen ideology trump healthcare in my own district. Why does my own district, the nation's capital, which by the way is doing very well, it has a surplus unlike many states, if you see cranes all around, why is my district a district which is labeled correctly a district with epidemic proportion HIV? epidemic means more than 1%. We are 1.9%, made tremendous progress, but only after I was able to do something that had taken many lives. Now, when lives are taken because of HIV, because we don't know what to do, then of course we wait for and get progress. But that's not what happened in the nation's capital. What happened here was ignorance and ideology trumped health care and knowledge. The Congress of the United States, which has some jurisdiction over the nation's capital, it does not over the states, rarely uses that jurisdiction, or when it does, I'm usually able to get it to move away. For example, we have members who each and every Congress try to wipe out all the district's gun laws. Well, I'm able to stop that. But we had a Republican, forgive me, majority in Congress for a number of years who took the position that the district should not be using needle exchange. Were it not for years disallowing needle exchange, the district would like every other big city. It would still have more HIV than some other places as a big city, but it wouldn't be in epidemic proportions. Now let me tell you what this means. This is worse than what I have to do with Congress very often, which is to say get off our backs and finally get something relieved. This took thousands and thousands of lives needlessly because we could not do needle exchange. What they do is to say no funds, not no federal funds, no funds of the District of Columbia may be used to engage in a program of needle exchange. And what that meant was that throughout the District of Columbia, at a time when there was more than there is today a drug epidemic, you got simultaneously an epidemic of HIV, and we are just recovering from that. I'm pleased to say, for example, that we've gone now from 147 10 years ago of people dying because of the needle exchange ban to only 7. In other words, 95% of that is gone, but we still are living with the consequences of that. We wouldn't have what we have today, which is an epidemic still declared in your nation's capital, but for the ignorance and ideology of the Congress of the United States, Republicans in the Congress of the United States.
And on that note, you know, while the U.S. Congress was more than comfortable to allow the people of the District of Columbia to die rather than to effectively use a prevention strategy that we know worked, no, the community rose up. The community responded to that neglect. And that's actually what we need to do now. No, we need to continue to rise up. No, these are certainly uncertain times. They are certainly hostile times in the fight against HIV and AIDS. And as we have done so many times before, we need to rise to the occasion again. And that has to be a critical part of what we're focusing on right now.
Phill, Jesse, how do you do that? How do you encourage people to rise up when there's so many things grappling for their attention?
We have to understand that we are each part of the political process. And our congresspersons need to know our message. During all of the efforts against the Affordable Care Act, literally thousands and thousands of phone calls were made to Congress to tell the story. And many of those stories were told about people with HIV, how access to care was going to be closed off, how access to their medications might be closed off. So we have to literally tell those stories because those stories make an enormous difference in this political environment.
Congresswoman, since you're an insider and you can speak to that, we have Alyssa from Twitter, and she said, what can we do to support advocacy efforts at the policy level if we live in a territory like D.C. and don't have a vote in Congress?
Well, having a vote in Congress isn't how I've been able to get things done. Fortunately, by the time the vote comes in, the work is done. So that I can understand the outrage of people who, by the way, are #1 per capita in taxes paid to support the government of the United States not having that vote in Congress and having no senators. The fact is, it hasn't much hindered me when it comes to the big issues of our time. As I indicate, we still have our gun control because you do your work before that matter arises on the floor. And indeed, the district has made tremendous progress. Once we got that needle exchange gone, our rate has gone down 70-some% for all forms of HIV. But what you can do is watch the appropriations in Congress. And do not just write Eleanor. Eleanor knows what to do. Write the chairman of the Appropriations Committee so he knows that people are watching him. Remember, he's handling appropriations for the entire country. He needs to know that people understand it and know it. It really does matter. You know, flash, this still is a democracy. And one way to know that is this. The president's budget cut everything to smithereens. I've never seen such budget cuts. We're talking HIV, but they were across the board. The Congress doesn't pay any attention to the president, whether it's Barack Obama or Donald Trump. The appropriators do their own thing, and they never cut or give as much as the president wants. So what does that mean? It means keep your eye on the purse strings. They are in the Congress of the United States, and the appropriators control how much money or whether you're going to get any money at all.
And for those who don't know, the chairman of the Appropriations Committee is who?
This year, now you've caught me off guard. Here.
Just write anybody, everybody on the Appropriations Committee. Yeah. So when you think, Phill, when you think about issues related to HIV and AIDS that are not getting the attention that they need, that we haven't mentioned, what comes to mind first?
Well, there are a number of things that come to mind, actually. You know, certainly we need to understand that HIV doesn't happen in a vacuum, so we need to pay attention to the social determinants of health. You know, the issues around housing, you know, the issues around addiction, the issue around food insecurity are all important as well. But probably at the top of the list, you know, given the advances we've made, making sure that people understand the prevention tools that are out there and that they have access to those prevention tools, and also that people understand the power of treatment. Now, I've been living with HIV now for over 35 years. I'm alive today because I have access to treatment now, and we need to make sure that anyone out there at risk for HIV understands that there are treatments that are available to them that can both prevent them from getting infected with HIV if they're not infected, and can help them live a long and healthy life if they are infected.
I think that's really important, and the platinum standard that the United States is missing is the number of people who are virally suppressed. In the United States, our glass is literally only half full. Only half of the 1.1 million people in the United States are achieving viral suppression. That is criminal when we have countries in Africa that were in the earlier panel being discussed have higher viral suppression rates than we do. And the number of people in this country who understand that PrEP can literally prevent you from ever becoming infected is shocking. I go around and I talk about PrEP and people look at me like, what? You mean there's a pill? So viral suppression, which can prevent you from dying of AIDS or ever acquiring or ever developing HIV/AIDS, and also preventing you from transmitting the virus, and PrEP are two of the most important tools in our toolbox, and so many people don't know how important they are.
Awesome. I have another question from Justin from Twitter. Current healthcare reform proposals would not oblige insurers, private or public, to cover Truvada for HIV prevention, which is what you were just talking about, PrEP. At $1,300 a month without insurance, it is inaccessible to most people, especially marginalized communities. What could cities, states, and civil societies do if this happens?
Well,
let's start by not letting it happen. Let's start there.
Right.
Well, first of all, I can tell you that my own city, for example, if healthcare gets taken away, they're going to try to keep people in healthcare. And I think where you have seen progress, you will see cities step up. You can't let Congress get away with that, though. You really can't let Congress get away with offloading the responsibility to a tax base that is smaller than the tax base of the entire United States. And that's why I stress, and it may be hard to believe when you see the divisions in Congress that you can have any effect on them. That's why I point to appropriations where what the president wants usually isn't what decides how much money there will be, and here is something that should go straight to him. And while I can't think of the heads of all the appropriations committees.
It's Chairman Rodney Frelinghuysen?
Frelinghuysen, which is a very good man from New Jersey.
Yeah.
And the Senate chairman is from Mississippi.
Okay.
And by the way, that Senate chairman has his seat because African Americans, when he was deserted, because there was a far right winger running against him, came to the fore because he had made sure that Mississippi got so much money, and I will think of his name because I think he would be very open as well. Cochran, Senator Cochran, one of the more senior members in the Senate, chairman of the Appropriations Committee. Thank you.
And so we talk a bit about the impact of the absence of health care on individuals with HIV and AIDS and how expensive it can be. What can you share with people who do not have HIV and AIDS and why this epidemic should matter to them and why they should be concerned about how this illness affects their fellow citizens?
Well, I think the most important thing for us to understand is that none of us are safe until all of us are safe, and that this is an epidemic that impacts all of us. There's probably no one in this country that doesn't know someone who is living with or who has lost someone to HIV. You may not know it, right, but we're all impacted by this disease, and the response to it is a responsibility of all of us.
Mm-hmm. Deaths are still happening in the United States.
Yeah.
That's part of the news.
Mm-hmm.
And in order for deaths not to happen, people need to have access to care. Mm-hmm. The story that is important is that those deaths are not being heard by the person who's turning 13 today, or the person who's turning 16 today. My late partner's death, his anniversary was on Sunday, 30 years ago. We're not hearing those stories, and so until we have that vaccine, no one is actually safe, because it's still possible to acquire HIV, and unless you're taking your medications, it's possible for you to still acquire AIDS and become very sick and die.
Could I say a word about women?
Sure.
Because I think the notion of men having sex with men, and of course that is where most of the issue is, has tended to obliterate how dangerous this is, what the high risks are for women, and what they need to protect themselves. We also have abysmal ignorance among girls and women about their exposure to the virus, and there needs to be real deep understanding with girls from the beginning, and with women who are exposed to men with HIV and may not know what to do or how to protect themselves, and how safe sex applies to men and women.
Congresswoman, how can we get this message targeted towards girls so that they grow up knowing what they can do to protect themselves?
Well, the very same people who have done, I say, a credible job in teaching girls how to protect themselves against pregnancy have a job to do with the virus as well. And it seems to me those go hand in hand, because either one can get you, shall we say, in trouble.
Absolutely. And what other areas are you seeing, Phill, that perhaps aren't getting the attention they need? We've seen girls, we've seen women, we've seen people in rural communities. Are there other populations?
Certainly, one of the populations that does not get enough attention is the impact that HIV and AIDS is having on trans women, and the violence that's been enacted against trans women all over this country. You know, trans women are disproportionately impacted by HIV, particularly trans women of color, and that's inextricably connected to discrimination and stigma. And one of the overlying factors that inhibit our ability to fight HIV is discrimination and stigma, whether we're talking about men who have sex with men, or whether we're talking about women, particularly women of color, or whether we're talking about trans women, or whether we're talking about young people. No, we have to be aggressive in addressing the issues around stigma, and we need to also make sure that we're addressing the needs of all of us. Nobody can be left behind when it comes to this epidemic.
Absolutely nobody. And did you want the final word here, Jesse?
The final word is that we have so much more to do. We have so much work to do in the South. We have so much work to do with some very key populations, with women, with the trans community, with youth, especially under 24. That work is not yet done, and in this environment, we all can be part of the political will to make it change.
Indeed. Unfortunately, that's all the time we have for today. I'd like to thank Jesse Milan, Congresswoman Eleanor Holmes Norton, and Phill Wilson for joining us. Now we will move on to the next portion of the program.